Hey everybody, good evening. I'm Dr. Robert Holland. I'm on next, I think. I'm the residency program director at Metropolitan Hospital in New York City. Just wanted to give some background on the PM&R program at Metropolitan Hospital. So we were established back in 1952, and we are partnered with New York Medical College, who is our sponsoring institution. That's one of the longest standing PM&R residency programs in the United States, which is pretty cool. Um, in the past couple of years, we've had a 100% board pass rate for our graduates. All of our fellows or all of our residents who are looking to do fellowship are matching to their programs. And we are achieving our goal of graduating residents who are prepared to enter autonomous practice or get those fellowships. We have a lot of stuff happening at Metropolitan, but Metropolitan is part of the New York Health and Hospital System, which is the largest municipal healthcare system in the United States. And so we are a safety net hospital to a lot of the people who live in New York City and the surrounding areas. And we have 27 different facilities within the health and hospitals family. And so after that PGY2 year, where you spend a lot of time at Metropolitan for the inpatient and outpatient experiences, you'll rotate to some of those other sites for opportunities, including sports medicine, pain management, interventional spine. And we're actually working to bring those services on site as well. We've recently started a mandatory third year medical student clerkship with our partnership with New York Medical College. So what that means is the every third year medical student at um, at New York Medical College spends 2 weeks with us on the inpatient rehab service. And I think sort of a recurring theme is people have not had a lot of exposure to rehab and maybe stumble onto it later in their medical student careers or things like that, as I did, and I'm sure many of you guys have as well. Let's see. It seems like we're having some trouble getting the slides here, is what I'm hearing from Alex Fields, who's our program coordinator, who's also on the call here. Hold on one second. Let's see. Try this again here. Sorry, guys. Bear with me. All right. Maybe we'll try it from this view at least. Okay. Um, So we have a 20-bed acute inpatient unit at Metropolitan Hospital, but we have been designated as a center of excellence for rehabilitation medicine. And actually, we have an expansion plan. We're going to be at 55 beds probably by the time future applicants would join us, which is great. So that first year, that Metropolitan is really inpatient and general outpatient heavy, right? And we focus on the things that you would expect on an inpatient unit: stroke and neurological disorders, TBI, ortho, rehab, spinal cord injury. And then we sort of advance in complexity as we go along. Let's see. Very good. We also have a very busy outpatient clinic. And the nice part is, as a hospital-based rehab facility, we have access to like all the hospital services and specialties that we need. Our outpatient focuses on getting that EMG and neuro and NCS training, spasticity management, ultrasound guided injections. We even have peds and cancer rehab, which is great. And then we have some specialized clinics, prosthetics and orthotics, wheelchair, vestibular, and lymphedema management, which are pretty cool. All right. We sort of touched on this a little bit, the progression through of what you're going to learn. The nice part about both the inpatient, the outpatient side, and the patient population that we serve, we have we're basically a community hospital in a healthcare desert, right? There's a lot of like people that really don't have health insurance or any payer source or things like that, and so a lot of our patients are actually treated free of charge. What that means is that it's a great opportunity for all of us, the residents and the attendings, to really participate in their care. The patients are very grateful that the care that they receive. And our model with the attendings is that nobody has any private patients, right? So at some other facilities, you might stand in the corner while the attending sees their private patient. At Metropolitan, you'll be sort of hands-on from day one. I mean, within a week or two of the new PGY2 classes started, everybody was already performing procedures in clinic and things like that. So it's a very hands-on program. supervised by the attendings, which is great. All right. Obviously, rehab is an interdisciplinary team sport, and we work very closely with our colleagues in physical therapy and occupational speech, nursing, social work, et cetera, in both of those settings. Very good. What makes Metropolitan unique? Like I said, we have, we are that community hospital right in the middle of, right on the east side there of Manhattan. We take care of a lot of primarily Spanish-speaking patients who are a very vulnerable healthcare population. And we have multiple training sites across the health and hospital system and even outside too. So residents will rotate to the Bronx VA, to Blythedale Children's Hospital up here in Westchester, New York, as well as Bellevue, Jacoby, Harlem, et cetera. So there's a lot of opportunities for networking with people who are making choices about fellowships and things like that in the future, which is great. All right. I joined the program in November of 2023, and we've really made a lot of strides and done a lot of growth since then. We hired Dr. Richard Ellis. He's our new director of inpatient rehabilitation, and he's been very well received by our residents and has really helped to grow that inpatient service. Knowing that a lot of folks are headed for sports or spine fellowships after us, we're working to bring those services in-house. We have a fluoroscopy suite on the 11th floor, and we are finishing the onboarding of an interventional physiatrist who will be doing, pain and axial spine injections on a daily basis with us, which is great. We're also looking to recruit some of our previous fellows or our previous graduates who have gone on to do sports medicine fellowships to come back and bring that expertise back to Metropolitan. And like I said, we're located in the hospital, right? So we have a really good collaboration with medicine, surgery, and all the other services that an acute care hospital provides to help care for our patients. All right. A nice thing about being really close to New York Medical College or partnered with them, right, is that we have access to all the research abilities that they have, their library, their research team. Those are at our disposal to help us work on publications and things like that. And many of we have quite a list of resident publications, which is great. Diversity-wise, Metropolitan was recognized as one of the most diverse and inclusive hospitals in the state of New York, which is fantastic. And when we're looking to recruit for our program, we take that into consideration. We have a great combination of traditional, pathway people, as well as folks who are coming at this from a different way. One of the candidates we just matched with came from outside of the country, and he's looking to get that rehab experience, bring it back home, and start up a rehab hospital there. So it's fantastic. All right. We have a great success rate. We just today actually received the scores for the part 1 of the boards for our last round of graduates in July, and everybody passed on that first attempt. And all of our graduates are also securing those fellowships in sports and interventional spine for the most part, but we are matching for fellowship 100%. So in the interest, this is our contact information here. Like I said, I'm the residency program director and the chief of the service at Met. Alex Field is our residency program coordinator, and here's our contact information if you guys have any questions or anything. I'll stop there. Just in the interest of time, I'll stop there for the next presenter, but does anybody have any questions while I'm here? All right. Very good, guys. Thank you very much for having me, and good luck.
It looks like there was one chat in the.
Oh, missed it. Sorry. Let me see what's in the chat there. Hold on. Chat. There it is. All right. I have how many EMGs are residents expected to perform, and are you all meeting the requirements? Yes. So as I think the program, the graduation requirements for the EMGs has been decreased with the upcoming classes and stuff. All of the graduating classes, though, are meeting the numbers for the EMGs, injections, axial injections. All the procedural log numbers are being met, although I think you guys have to meet 50 less of them now these days, and the emphasis is now on like the Botox injections. And then here's another one. Is there any involvement of the program in the community like adaptive sports? Yes, absolutely. There are, it's Manhattan. There's a lot of stuff going on. And between myself and some of the other rehab chiefs at our other facilities, we're always sharing opportunities for adaptive sports or other interactions with the resident cohort and making time for those things. I think we just we just won the rehab bowl too, Metropolitan. It's kind of like trivia night for rehab with some of the other programs in New York City. So I was really amazed and thrilled that my resident cohort took home the trophy this year. All right. All right, very good. Well, thanks a lot, guys. I appreciate the opportunity to talk to you. And, you can find out more about the program on the Metropolitan website as well as the New York Medical College website. And if you have any questions after the fact, you have our contact information. And Dr. Frank, thank you very much for getting us connected this evening. Appreciate it.
Of course, happy to be a part of that. And if anyone has any questions for residents, you can reach out on our Instagram as well.
All right. Good night, everybody.